Is she okay at it? More sedation.
More sedation for this female patient, one of 20 in the medical intensive care unit. On this Tuesday morning, every bed here is full. Everyone is on a ventilator. This is where the sickest patients with COVID-19 in Manitoba end up.
Concerning as well is the fact that often these people have to be sedated, sometimes deeply, sometimes even paralyzed, because of the respiratory dysfunction they have.
The mood, solemn, quiet, as staff monitor patients inside negative pressure rooms. There are 3 overflow ICUs now to treat the surge of those critically ill with the virus. Dr. Boyan Panovic says compared to the first wave, those winding up here are younger and younger.
If patients are deteriorated to the point that they need to be on a mechanical ventilator, it's very common that they're on it for at least 2 weeks or longer.
Many can't be taken off and are moved to palliative care. 3 other wards like GD2 have been converted just for COVID patients. This used to be an orthopedic surgery ward. Now it's a red zone COVID positive unit. And for the staff inside, it's meant big changes.
If you were to speak to them and ask them have they had experiences with patients who have passed away, have they had experiences with codes, many of them would say very rarely, and now that's become commonplace here.
There was a lot of anxiety from staff, pushing ourselves well out of our comfort zone.
For nurse Erin Turner, part of the job means connecting dying patients with their families.
I was responsible for setting them up with an iPad to actually say their goodbyes, and seeing that is it's very emotional, and it would be very difficult. So that's an impact that we're kind of taking on as well.
On any given day, this 30-bed unit is full. Staffing levels are also a moving target.
We are in a nursing shortage, we're in a support staff shortage.
Managing staff levels and the safe flow of patients is paramount right now.
21 of them are COVID.
Which beds are open, where patients go, and where they can make more room is all decided here at the hospital's command center.
We're always planning for surge capacity. So if something's going on in a specific region, and we know that there are going to be people affected, depending upon what their care needs are, we'll be ready for when they show up.
These screens map occupancy and which wards have positive patients. The daily task, where to put the sick people who keep on coming.
We can get hospital beds. What we don't have is staff, right? That is our limiting factor.
The gowns are just on this side.
Inside the ER, it's a new kind of chaos. Screening, triaging, and treating the revolving door of emergency patients.
There's been some talk that emergency departments don't look that busy, but I assure you it feels like we're very busy.
During our visit, 2 patients are brought in by ambulance to be resuscitated. The ER has been entirely redesigned for the pandemic. Air scrubbers improve air exchange. These plastic curtains wrap around all 61 treatment areas, and all patients are approached by staff in full protective gear.
With the community spread and the positivity rate in our community, we have to assume a lot of those patients coming in have COVID exposures in the community.
Because of that, the new price of admission to the hospital, a rapid COVID test. Up here at the lab is where all of those samples are taken.
These lines literally tell you that there's a positive sample in that run.
Each one is entered into the digital recording system, and the results ready within a few hours.
The COVID-19 samples coming in essentially double our normal daily volume of testing.
The commotion here, a stark contrast to the hospital's empty operating rooms. Life-saving procedures are still going ahead, but all elective surgeries are canceled right now as staff are redeployed to treat COVID patients.
I talk to my kids who are in the 20s and they go, if I get COVID, it's not going to bother me. And I'm like, yes, but if you blow out your ACL skiing, or you tear your hip, or you get breast cancer, or you need a hip replacement, you're not getting that done.
Roughly 6,000 surgeries were canceled during the first wave of the pandemic. Dr. Edward Bushell anticipates 6,000 more people won't get the surgeries they need during the second wave.
Those numbers are real. They affect every single person. They could affect you.
Back in the red zone, the patient load is unrelenting. Nurse manager Anna Marie Papis.
I had people who would voice to me they don't know how much longer they can keep doing this. And now I look where we are, and it's almost become fairly normal to them.
To date, the virus has infected more than 21,000 Manitobans and killed more than 500. Just today, 14 lives were lost. So a stretched front line forges on. Jill Kubra, CBC News, Winnipeg.